Good morning, everyone. This is Allie Holton-Stroop. I'm the CCT lead for TennCare. Thank you so much for joining us today. Today, we're going to be reviewing the updates in our CCT that were made in January to the ADT and Member Search section. We do have a few housekeeping items I'd like to share with you before we get started. So this session is being recorded. This recording will be available on our CCT Learning and Training webpage by the end of the week. So those of you who maybe want to watch it again, or if you have colleagues who weren't able to attend and want to review this video, will be available by the end of the week. We are going to be using a specific training environment, so it will look maybe slightly different in some areas than what you're used to seeing in the live tool. Obviously, all the data has been de-identified. It is not for one specific organization, and it is from a segment in time rather than live updated information. All participants are muted in this session. We encourage you to use the chat feature for questions or technical support. We just request that you don't use any PII or PHI in your questions. We do have Cynthia and Megan here today helping with any technical questions and making sure I get all of your questions answered today throughout this session. So thank you both. All right, so for today's agenda, we're going to be understanding the member search and export feature updates. So how you can segment your member panel according to things like demographics, the new higher visibility of THL status, health plan, etc. We're also going to be understanding the ADT search and export and segmenting your ADT data according to things like the higher visibility, THL status, discharge date, demographics, etc. So before I jump into the tool, I did want to give a little bit of a view of what we're going to be seeing in the tool, so we have this. And I will send out these slides later this week when we have the email update going out, so you have those for review. So the member grid update, you can see over here, we have now the THL status or Tennessee Health Link program status with much higher visibility. So previously you had to select the program over here for THL and then the program status. So if you were looking for all of your active THL members or attributed not enrolled, you'd have to do specific filters. So we worked with the vendor to make this a higher visibility and just show the status for all of your members for an easier, quicker review that works with more organizations' workflow. So if you're wanting to get all of your members in one place and have their THL status, this is now much more visible and easy to see. You can, of course, export from here as well to do more data analysis or divvying out based on your workflow within Excel. We've also made some of those updates in the ADT grid update. So again, here, when you're doing your ADT search, there's a new column indicating the member's THL status. And then there's also an ADT load date and time. So this is something that was in our previous tool that was requested to be added to this, just so that organizations, individuals would know when this data was actually loaded into the tool. So we have higher visibility of that for everyone to see now as well. And again, this information can be exported, so you can do more divvying out or analysis within Excel. So when we're looking at the export updates, what you'll be able to see now includes the member's full address and phone number. So this is something that we had gotten feedback on from our initial trainings, that it would be much easier to have a full address for each member, much more highly visible rather than going into the care plan, have that in the export. So that is now available in both the ADT and the member search exports. So you can see that the address is broken out. You have their street address, their city, of course, their state and zip code, as well as county, and the phone number, which was another key component we heard, which is more difficult when you're having to search for phone number when you're trying to do care coordination. So we have it all here right in the export to make it much easier for care coordination for you. We also have the THL status, if applicable, for the member. That will be showing not only in that grid for the search, but also in the export. So for example, if they're active or attributed not enrolled, and you can use the filters within Excel to select which THL statuses you're interested in searching by within the Excel itself. In the export for ADT specifically, you'll also see those load date and time. So it's not just in the grid view for the search, you will have that date and time stamp within the Excel itself. Okay. So now that we've gone over kind of what to expect within the tool, let me actually switch over to the tool so we can start looking at this within context. And if there's any questions so far, please feel free to put those in the chat. All right, so I am logging into the training environment as a practice administrator. So it'll take us to our dashboard as the landing page, which is going to be the same for practice administrators and care coordinators. And we're going to start by focusing on the member search first. I'm going to come over here to the left-hand menu and click on member search. And it's going to automatically pull your member panel. And so I do see your question, Danielle. That's a great question. So you do have the ability to see a member's date of birth here within the member search right here. And that's available on the export as well, which we will show just a few minutes. I can show that. So from here with the member panel, you have the ability, again, to see your full member panel, which will load here. We have our member name, date of birth, their age and gender, which health plan they're attributed to, their MCO member ID, their social security number, any primary or secondary care coordinators as assigned by the organization. And this is, again, only if the organization is choosing to assign care coordinators to members within the tool. You also have the ability to see assigned provider. Here, we have the member's phone number, their risk level, and their risk score. And we also have any chronic conditions that may be associated with the member. So you may remember from our initial trainings, it will only show one within this column, just due to space. But if you click on the triple dots, there is a hover over that says read more, and you can click that and you can identify any other conditions beyond the one showing in the column. When you export this, all of the chronic conditions will load in the export as well. All right, and then finally, we have our THL or Tennessee Health Link status for those applicable to. So if a member is active in THL program, for example, you would be able to see that status here. So this is something that could be helpful for not just the THLs, but also our PCMHs when they're working on care coordination. So from here, if you wanted to do some more segmenting, for example, if you're wanting to only see your members from a certain health plan, you can still absolutely do that. Up here under health plan, you can select the specific health plan or health plans you're interested in. Or you can even search by a specific care coordinator. This is a question that I've been getting a lot lately. So if your organization does have a practice administrator assigning members to a specific care coordinator, let's say you're logging in as a care coordinator and just want to see your specific members assigned to you, you can go ahead and filter this down to see only your assigned members. So you just select your name here and then run the search again to narrow down the population to your assigned members. You can see we went from over 3,000 members down to 311. Make it more manageable. And this can be very helpful, especially for our large statewide organizations who have, thousands of members. And if you're just wanting to see your assigned members, that can definitely make it much more manageable to go through the data. So if we wanted to export now and do some more divvying out or do some data analysis, and we will come over here to this Export to Excel button. I'll give that a click. And this is really where we can do more of a wider view of looking at all of this data. So if we export out, this is what we'll be able to see. So we have our beneficiary status, and that's meaning their TennCare status. So all of these are automatically going to be pulling those active TennCare members. We then have the member name, their date of birth, age, gender, race, ethnicity. Of course, these are only if they're being populated in the information that our tool is being sent. So for the member information, we usually do have race listed, but we do not always have ethnicity. And again, this is a big section of what was just added to be to make things much more care coordinator friendly. So we have the member's full address, so street, city, state, zip, and county, as well as their phone number. All right, we also have the member's attributed health plan and MCO member ID, their social security number, primary and secondary care coordinators, if those are being assigned by the practice. We have their assigned provider, their risk level and risk score. Let me just scroll over. We also have the ability to see the chronic conditions. So again, it will list out all of the members' chronic conditions here without having a hover over. And we can see the member's THL status if applicable. There are additional columns of information that may not necessarily be relevant for you, so you can always hide the columns that are not of interest to you, that you're not searching for that information on. And that would be an age range if you're interested in that, a recent diagnosis date or diagnoses, prescription date, medications, service date, procedure. So you may not need any of those. So you can just either hide them or ignore them. Okay, so with this, I want to stop here and see if there's any questions on the member search or export feature update.
Hey, Allie. I think Daniel, hi, I think Danielle had a question, a follow-up question about the date of birth search.
Sure, okay, so that looks like it's more about the ADT. So I will go over that once we're in the ADT section. And then it looks like assigned provider, excuse me. So the assigned provider is that assigned provider for the organization. So for example, our test or training environment is a PCMH. So this is showing the assigned provider within that PCMH. This is what is coming over in the MCO attribution files for us. So if this is a THL that you're looking at, the assigned provider would be the organization, as that's how it is sent over in the MCO attribution file. So if they were attributed to Centerstone or Alliance for their THL program, that's what would be showing here. And let's see, is there an easier way to search by provider? Right now, ours has all providers listed, including past providers. So you have to scroll, change the number shown, or check all the ones you want? So that's a great question. So let me switch back over to that view. So if we were to look for a specific provider, we do have the ability to type in a specific name. So if you wanted to search for a specific provider, maybe you're looking for specifically just Dr. Aker, and he was not the first person coming up. You could do that here, or by first name. Does that help answer the question, Jen? So Jen, I'm going to go ahead and unmute you. If you could give me a little bit more on your question, that would be helpful so I can help you.
Yeah, I was in the middle of typing.
Oh, sure.
So I had a problem where I was trying to look at certain providers with the list, and then when I was clicking on them all, you had to scroll through all these to pick all the different providers that you want to hit select, and there's not like a back button to maybe go back and remove them all. You have to go back into it and uncheck them all, and I just didn't know if there was an easier way.
Got it. Okay, so you're wanting to choose multiple providers at a time, it sounds like.
Yeah, or specific multiple ones. Ours has got all the providers that's ever been with us that are no longer here as well listed.
Okay. Yeah, and these are all pulled by our provider lists that are still on file for us. So that's what's populating here. So this is a good question. You can select multiple individuals. So if you wanted to search by multiple names, you could do that. So we would do maybe, let's see if there's anyone named Smith, you could go ahead and search for a Smith. And then once you found the specific Smith, you would give them a check next to your name. And then maybe you wanted to go back and also add Aker to the search, then we could go and add Aker. That may still be a little bit too timely if you have a lot of individuals to do that with. I would say if you really have quite a large list of individuals that have left your practice, you can always send that over to our 10care.cct@tn.gov address. That is not an area that we would be cleaning up, but I could send that over to the provider services group to see if that's something that they can help with, which would then update our portion of the tool. So great question, Jen. And then I see there's this question from Sarah, selecting care coordinators to look at your own individuals. It says no data found. So if you're selecting yourself from here, we should be able to see anyone that was assigned to you by the practice administrator. So if it's not showing anybody, and your practice administrator is definitely saying that they've assigned members to you, that sounds like a bit of a technical difficulty, and I would contact the Healthy C support desk, and I can get that email address up for you right now. But definitely check with your practice administrator first to make sure they did indeed assign members to you to be able to see. And then I did see this message, is there a way to add a clear search tab? That is a great question, and it's actually something we are working on with the vendor to add, because we understand it's difficult to have to try and rerun a bunch of search criteria. So we are definitely working to have that added in the near future. So more to come on that. Okay, and it looks like someone is saying that some of their members are not showing an assigned PCP in the system. If you want to email us at the TennCare admin email address, we can look into that a little bit more. If you could send some examples for us to look into, that would be really helpful. Thank you, Cynthia. All right, these are some great questions. Yes, so the PCP will export into the Excel sheet, and it shows up under Assigned Provider tab. But again, if you're with the THL, the assigned provider will always show the organization as the assigned provider, as that's how members are attributed on the MCO side. So the data is sent over showing the practice name instead of a specific provider. Correct. In the export, it will show the organization name as if you're signed in as a THL, it will show the organization's name. And I am signed in right now. This is Care Connect Pro, so great question. So the report section for 3D analytics would be over here under reports. Yes, you're very welcome. And then there's a question on, will you be able to do attestations and upload closed gaps in care on the CCT? You are able to manually close gaps in care on the tool. I definitely would refer you to look over to our quality measures trainings up on our CCT learning and training page. Just as a reminder, manually closing gaps in care in the tool is simply for keeping all of your all the individuals working on a member up to date on what actually opened. So it's for care coordination purposes. There still needs to be a claim submitted indicating that the procedure or visit was completed to close it formally on the MCO side. So I have a question to show the CCT learning and training page. So here is the CCT learning and training page. I will share that web page with everybody now. And we have all of our quick reference guides, frequently asked questions, and we also have our YouTube channel with previously recorded training sessions that will be helpful. So this one specifically would be under the quality measure. All right. And then I do have a really good question here about finding the member's eligible effective date or attribution date. You have to go into their specific care plan. That is correct. So we do actually have a request to add the attribution date to be more easier to find so that it can be pulled en masse rather than having to go drill down by each individual. So that is something that we're working to have added later this year. But as of now, that information is found at the individual level within the care plan. Great questions, everyone. Okay, I'm going to switch over now to look at our admission and discharge section. So we come over here to the left-hand navigation menu and choose admission discharge. And for this, it does not automatically load data. You'll have to actually choose what time frame you're going to be looking for. Because I'm in the training environment, it is not up-to-date data, so I'm going to go back 6 months. Just as a reminder, you do have to choose timeframes for both admitted on and discharged on. This is an and or search kind of situation. So if we're looking for anyone admitted on any date within the past 6 months and or discharged on any date in the past 6 months. We can also do a specific time frame. If you wanted to do that, you would just select other here, and then you would choose the specific date ranges. So admitted on, you would choose the specific from and to dates, and then discharged on the from and to dates. But just for the training purposes, I'm going to stick to 6 months and do our search. All right, so you can see we have some of the same columns that we had previously. So we have our member name, the health plan they're attributed to, if a care coordinator is assigned, any information on the date they were admitted, and then if they've been discharged, the date they were discharged on. We have the visit type, which would be inpatient versus emergency. We have the status, so whether they're still admitted or if they've been discharged. We have their assigned provider. And let me just scroll over to the rest. Then we also have admit diagnosis. This will only be populated if the hospital sending this data enters an admission diagnosis. We have the source, so which hospital is sending this information. We have their prospective risk score based on the CDPS plus RX. And then we have a THL status, if applicable, as well as that ADT load date and time, so when it was loaded into the CCT. And then, great question. Will they be working on preference selection in the future for exporting to show a specific number of patients or a date range? So we are working with the vendor to see the possibility of creating a more customized export for what you're able to choose, but you are able to select how many members you'd like to be shown here at this current time. And then you can do any filtering once you get to the exported Excel that you are wanting to drill down into. So great question. And we have not discussed adding the specific load date as a search option. If that's something you think would be helpful, definitely reach out to our CCT admin email address to give a bit more on how that would be helpful for your practice, and we can start that discussion. And let's see, is it possible that a bed approval will generate to the feed? I've not heard anybody waiting for a bed at the hospital to show that they're in the hospital. So if you want to send that securely over to our 10care.cct@tn.gov address, we can look into that. That does not sound right, Chelsea, so thank you. All right, so once we have our search criteria here, and you can drill down further than just dates. So if you're wanting to search by specific care coordinator, if you're wanting to search only by those admitted or only by those discharged, you can absolutely do that. Or if you're wanting to just see those emergency visits or inpatient visits, you can search by visit type. You can also search by a specific hospital. So I know there are some organizations that work with many different hospitals, but there are some who get quite a bit from specific hospitals. So you can just search by a specific hospital if you're wanting to see that information. And of course, you can always search by the member's county of residence. They're not where they were admitted, but their county of residence. or if you're wanting to narrow down by specific health plan or risk level, you can definitely do that. So once you have everything here and your search is pulled up for what you're looking for, we can go over here and export to Excel. Give that a minute to load up, and I'll show you what that will look like. And I did almost forget the question before. So date of birth, yes, Danielle, thank you. You're correct. That is not showing on the ADT. That is not something that is currently sent over by the hospitals. So that would have to be kind of compared with the member search or the going in to see the members more detail, like the care plan. Let me just open this up. All right, so ADT. I misspoke. So Danielle, it is here in the export. It is just not showing on the search grid. So you are able to get it if you export it to Excel. And Penny, I do see your question about searching by members county. Excuse me. So it could be that a member is showing their residence as out of county. We hope it's not very many, but there are address changes that may be notified to us, or maybe they've not yet updated their address with Penn Care. So it could be a variety of reasons. So it does have the ability to show you out of state counties for members. All right, so with our ADT export, we have the beneficiary status, and again, this is Penn Care status, so we have everyone showing as active. We have their member name, we have their date of birth, their age, gender, race, ethnicity. We have their full address, their county, and the phone number. I'll just scroll over a little bit more, sorry for your eyes. We also have the MCO member ID, their social security number, care coordinator if assigned. We have the assigned provider, their risk level and risk score, any chronic conditions, and then if applicable, the THL status for the member. It also indicates the member's MRN from their hospital stay. So this again would just be specific to that hospital that they visited. And then some hospitals do send a specific location where the member had been assigned. So that's what this information is. And then it will indicate the date they were admitted on. We also have the time of ER admission if applicable, the date they were discharged. Then we have visit type, so inpatient versus emergency, and their status, whether they're admitted or discharged. We have the admission diagnosis if that's being sent over by the hospital. And then we have the source of the hospital. And then last but not least, the ADT load date and time. So you're not able to search in the grid at this time by load date and time, but you certainly could filter out by adding a filter at the top and focus on a specific load date and time that you are interested in at this point. And then I have a question. So if the members are not active with THL, will they show in this? So if they are active or attributed, not enrolled, any of those, excuse me, we'd be able to see them. You'd be able to see discharge just for that week, but once they've been taken off the attribution file, they'll no longer show. You can also see the inactive with no BH treatment. So maybe they haven't come in in the last few months, but they're still attributed. So those are the 4 that you'd be able to see. And again, discharge would only be until they've been taken off that attribution file. So hopefully that answers your question. It's a good question. And then there's the question on Social Security numbers being incorrect. So if you're seeing it incorrect in the member search, that could be an issue with the data that we have or the MCOs have. But if it's on the ADT side, it could be that the hospital misentered that as well. Because again, all of this data is coming specifically from those hospital sources. And then we have a question if there's a specific way to pull all of the discharged THL attributions. Yes, there absolutely is. So you would, let me switch back to the search engine. So for that, you would be able to come back up here and we will go to the member search specifically. Oh, and of course, I'm logged out now. So bear with me just 1 minute while I sign back in. And thank you everyone for all the great questions. These are wonderful. Okay, so if you are specifically wanting to see all of the THL members that are indicated as being discharged from THL, you would come over here to our member search, and we would do some focusing and filtering on the member search. So we would choose THL as the program, and then the program status you would choose discharged and be able to filter your search that way. You could, of course, narrow it down even more if you wanted to just see your higher risk discharged, or maybe by a specific care coordinator. You could absolutely do that as well. But it will definitely narrow down to those specifically indicated as discharged on that latest attribution file. And we get those attribution files at the end of each week. So you would always see it at the beginning of the next week. So great question, thank you. And then there's a question on if there's a way to change the time it logs us out. Do you mean the timeout number? So if you're not active for a specific number of minutes? Yeah, oh, that's a great question. So that's actually automatic. There's no way to customize that. So, and I believe it's 15 minutes. Cynthia, Megan, correct me if I'm wrong, but I believe it's 15 minutes timeout. So great question. Perfect, thank you, Cynthia. So 15-minute timeout, and that is automatically set. That's not something that can be customized. And okay, so Chelsea, if you're seeing that it's kicking you out really quickly, frequently, definitely contact the Health EC support desk. That would be a technical issue that they would put a ticket in to fix. So great question. And then when claims have been closed, the gap is closed. How long does a gap take to reflect a closed gap on the CCT? So that's a great question. So it can vary. So, you know, sometimes it can take a while for a claim to even be sent out after the service was provided. So, we may not end up getting it at TennCare for, several months, several weeks. It really depends on how long the process takes and how long it takes to even send out. So that is why we do have the ability to manually close gaps within the tool so that everyone is staying up to date on what has actually, taken place. So if someone came in for their well child visit, for example, you could manually close that. It just would not be the formal closure. It'd just be the way to keep everyone on the team up to date that, yes, this well child visit has been completed while the claim is going through the process of being processed and then getting to us. I will say, though, that we do upload claims data every week. So once we get it, it's going into that tool every week. So I hope that helps. And let's see, do you think they will put a separate section under the total members to show the new patients as THL or MTM new? Okay, let's see. So they're not new to your program, but they're new to MTM. Is that what's happening with your specific situation? I'm sorry, Jen, I'm trying to understand this. I'll just let you give a minute to type that out. But as of this point, it's new based on MCO attribution. So if they were new, let me just go back to the dashboard. So when we are looking at the dashboard over here with our total members, the new is indicated actually by MCO attribution. So if there was maybe a, and no worries, Jen. So for total members, the way that the new is identified is based on MCO attribution. So if somebody is maybe fallen off for a week or two, that could be why they're showing back up, but you recognize their name because they've been getting services. So that could be potentially what's happening. Because this is, again, based on attribution files from the MCOs rather than starting MTM or THL. So hopefully that makes sense. Any other questions or specific examples, you can always send over to tenncare.cct@tn.gov if you feel like it's not indicating accurately. Great question. Let's see. When a change is made to a claim, is the loaded into ADT with a new load date? Or does it keep the original load date? CC duplicate. So when we have ADT information sent over from a hospital, that will indicate the load date and time for getting that information from the hospital. When we get claims information, so whether it's professional or institutional that help close those gaps, that would be separate. So, that would not be connected to the ADT. It would indicate then that maybe if you had manually closed the gap, it is now closed actually formally by the claim that was submitted and the date and the date the service was provided for the claim. So they're two separate things there. So I hope that helps clarify that for you, Haley. And then a question, so MCOs do have a slightly different view. That's correct. Their left-hand navigation is going to be forms and resources and admissions discharge only. So you don't have the member search section. And then the question on if there's a specific day the data is uploaded or just when it's provided. So it depends on what the data is. The MCO attribution files and claims data are over the weekend so that it's uploaded when people are back the next week. ADT data is just ongoing as that's sent. It's near real time. And thank you so much, Megan, for putting that information in for data quality issues. That's very helpful. All right, these are great questions, everybody. Any other questions on the member search or ADT information, with whether it's the updates to the screen or the export? And these, again, have been great questions. We have a few more minutes, definitely take some time to think about it. While you all are thinking of questions, oh, of course, wanted to go back to the beginning. Just some things to know while you all are thinking of potential other questions before we wrap up. This training, again, will be posted on our YouTube channel by the end of the week, and you can find that through our CCT Learning and Training page. We also want to hear your feedback. So I know we've heard from a handful of people on some things that are working well for them or potentially could be improved on. We want to hear from everybody. So we are actually sending out a CCT user experience survey this Friday. So please watch your inbox and take just a few minutes to complete and submit to us by Monday, 3/8. Again, we really take this feedback to heart. We want to make sure that we're providing you the best information and making this tool useful for you all. So we are looking forward to seeing your feedback on how the tool is working for you thus far. For technical difficulties, and it sounds like there may be a few issues that are going on here. So if you're having trouble logging in, or maybe you think the tool is kicking you out way too quickly, it's not meeting that 15-minute until you've, clocked out that 15 minutes, definitely contact our HealthyC support desk team. You can either email them or give them a call if that's easier. So that is available for you. They are open state hours, so Monday through Friday, except for state holidays. As a reminder, I know we have some new individuals joining some organizations, so it is required to complete the acceptable use policy and remote access request forms to get access to the CCT. And you do have to use a professional email domain. Consumer domain email addresses are permitted by exception only for very small organizations. So if you're needing the security forms, reach out to us at 10care CCT Administrator, which is the 10care.cct@tn.gov. All right, let's see, we do have a few more questions. Let's see, why the diagnosis is sometimes not listed, but if you go to the member info and episodes, it will show a diagnosis. So diagnosis for ADT, the admit diagnosis, would only be showing data that was sent over by the hospital. So if it's ADT, that may be the reason. But if you go into their care plan, once a claim comes through, we can see more information on what they were admitted for. But if this is for a different part of the tool for diagnosis, there could be something else going on. Okay, great. Glad that answers your question. And then just another request to have the link to watch that recorded video. Again, this is the link to our learning and training webpage, and that will be available later this week. And then there's a question on, would you say that providers can get their most updated gaps in care report every week? So we do have the CCT updated every week with claims that have been processed. So you would have that updated in here in the tool. It's even more updated if your organization chooses to manually close gaps, just to show everyone that, you know, a gap in care has been met while you're waiting for the claim to go through and be processed for formal closure. And then question on signing up for the new tool. The turnaround time is about a week. It can be less, especially with state holidays, it's more like a week. So, but it is pretty quick. The biggest things that we've had that have delayed them are individuals not providing their full or accurate tax ID number when signing up, or providing a consumer email domain address rather than their professional email domain address. So something to definitely keep in mind when you have new staff member joining, that they complete those correctly the first time. Great. Well, thank you so much, everybody. This has been a great session. We've had some really great questions come from you all. I really appreciate your time and attention. If any other questions come up that you think of after leaving, please feel free to email us at tencare.cct@tn.gov. We're happy to answer those. And again, this video will be up on our CCT Learning and Training page via the YouTube channel for you to review later this week, or if you have colleagues that weren't able to join and want to come back and review later. So thank you so much for your time. Really appreciate it, and I hope you all have a wonderful weekend. Take care.